good afternoon and welcome to the first Hartus meeting in Rome. This is the second episode of In Conversation with Knights, and I'm here with Professor Grigorios Grimbizis from Thessaloniki University in Greece, whom I thank a lot for accepting our invitation.
Thank you.
Thank you.
Thank you very much. I'm really very glad to be here.
Thank you.
In this organization.
We are going to ask Professor Grimbizis sort of short questions, and we start with the first. What is the kingdom you identify yourself with, in case it is only one?
So actually I'm in between two kingdoms. My main kingdom is hysteroscopy, but of course, from the beginning I'm doing also IVF. But I'm mainly oriented in hysteroscopy and also endoscopy. So I think that the two kingdoms, they are going parallel. Of course, the third one is really very helpful, but I'm in between. But mainly hysteroscopy.
What is then the strongest weapon as a procedure or as a technique in the kingdom you belong to regarding the infertile patient management?
I think that the evolution of technology provided us with, more minimized instruments, the miniaturized instruments, and also the way that we can look in the cavity. It's the most important tool that we have in our hands, because in this way we can discover pathology that it was undiscovered in the past, and in this way we can help the women not only diagnosing pathology but also treating the patients more successfully.
So, next question is, if you could fight for an update or a modification in the latest recommendations regarding the workup of the infertile patient, what would it be?
My view is that actually, what the recommendations provide us is what is, the evidence at the time that they wrote the recommendations. And we have a lot of open issues, and for that I think that we have a lot of uncertainties. And in this way, I think that an update of the recommendation is really very useful. Every maybe 2 or 5 years, because this is important as far as these recommendations are involved in everyday practice of the workup of infertile patients. And the problem is sometimes that with the recommendations, you provide in bracket certainties, to the people that they are looking, and this could create some problems, in everyday practice. So an update, I think it's really, based not only in the evidence, but also, in the best clinical practice described by physicians and by doctors dealing with the topic. It's really very important. And also, my view is that, in the recommendations, we have to have some open fields, because usually what they provide is what is recommended and what is not recommended. But, if you don't recommend because there is no evidence, that does not mean that there is no problem. So instead of non-recommendation, I prefer just to mention that this is an open field, for research and clinical, evaluation.
Thank you. The next question is, what is then your unpopular opinion among the other knights in your kingdom regarding the infertile patient workup?
So what is the unpopular, recommendation? I think that, the problem is that, in a lot of uncertainties, they give recommendations that they are not helpful for the infertile women. And as an example, I think it's the treatment, the evaluation by hysteroscopy, which is, according to the recent recommendation, is not indicated. So we have to look again, because there is an indication, of hysteroscopic evaluation of the endometrial cavity in IVF patients or in infertile patients. And this has to be, based not only on a failure of IVF, but also on the history, or maybe in other parameters, age. And we have to be very careful, because we have to help the women instead of putting them in very difficult dilemmas to ask if they have to do or not an hysteroscopy when this is really indicated.
Perfect, thank you. Next question is, what is then the most medieval practice that you see still going on in your kingdom?
For me, the problem is that we don't have to abandon. We have, actually to, let's say, personalize, let's say the treatments, to the patients. For example, for the treatment of, let's say septate uterus, we don't have to abandon. We have, to personalize, and also, we have to make the septum resection, in very selected cases of women, but this is just only an example. For example, for the polyps, there are some publications that they say that we have to abandon, this, or this is not playing a role, let's say in infertile patients, but, the proof is there. So, from the current practice that we have, in the evaluation and also the treatment of infertile patients, the problem is not something to abandon. It's just, let's say, to adapt to the need of the infertile patient. We have to select. For me, I think that a procedure, but this is not for infertile patients, that we have, to delete from our armamentarium. It's just, the excision of the endometrium in cases of uterine bleeding, but this is not the case, of this congress.
Thank you very much. Next question is, for the purpose of the win, that is reaching the fertility outcome for the patient, who is the strongest partner among the other two kingdoms?
Both of them, they have a role. So, for example, before applying hysteroscopy or in hands with hysteroscopy, ultrasound nowadays is really, necessary. We cannot go to an invasive, although it's really minimally invasive procedure, without have some information of an imaging technique which is really, non-invasive. So what is needed is, before the hysteroscopy, it's actually, pre-hysteroscopy evaluation with ultrasound. This is necessary. But also, it's necessary, the ART in cases, that you cannot solve the problem of infertility, with endoscopy. So it depends. I think that both of them, they are really useful. The three, let's say kingdoms are really necessary for the infertile patients, and each kingdom has a role. And we cannot go in future without a collaboration of the experts, of the three kingdoms. And another way is just, somebody from one kingdom to get the skills of the other kingdoms. For example, there are people that they are doing hysteroscopy and they are really very good in ultrasound. So they are doing both, and this is something that... And also there are people that they are doing hysteroscopy or maybe endoscopy, and they are doing, very effectively IVF. I belong to the second one, but this is really necessary because this is the way to go on. Because our main aim is actually, to solve the problem of infertility and to help the infertile patients.
Perfect. Last question, a bit provocative, on the battlefield.
Yeah.
So if there was only one knight that you dare, that you fight with, or that you challenge, who would he or she be?
Serena Guerra.
Careful, nomen omen. So there is a danger in the surname in this case.
Okay.
Thank you,
Thank
Professor.
you very much.